Yes, so there is a countdown. Yeah, I'm ready. So I think it's, yeah, can you see me now? Great, great. Okay, okay, thanks. Hey, hi, good evening, everyone. We'll begin the session maybe in a couple of minutes. Hi, good evening, everyone. I'm Dr. Sibasish Dey. I work as a consultant with ResMed, and thank you, everyone, for joining in this particular session. And what we are going to do in the next maybe half an hour or 40 minutes is I'll try to take you through the different aspects of sleep and how it impacts your overall well-being and your overall health. So we'll try to understand sleep, and we'll also try to understand how can we deal with the current scenario where even our sleep is getting impacted. But I think, first of all, thanks, Global Insurance Brokers, for having me here. And I hope everyone will find this session very useful. So, if you can see, ResMed is one of the leading sleep device companies across the globe. And we are, in fact, one of the pioneers of in sleep medicine. So ResMed is one of the company which has basically uh, led a lot of innovation in terms of sleep medicine. And currently, we have operations in 100 countries with over 7,500 employees. So this is what ResMed is. And currently, what's happening, I think everyone is facing the same scenario that we are working from home, and at the same time there is lockdown. So this is a kind of a double whammy. There's so much of high reliance on technology. We are constantly in a sitting posture, right? uh, and of course, at the same time, what's happening is that we are having all the communications through mobile calls and instant messages. Okay, so I think at the same time, what's happening is that there's a lot of tea and coffee intake, and often the I think you guys cannot hear me. Can you hear me now? Hi, can you hear me? Great, great. That's Anuj. I think he's saying that he can hear me. So thanks so much. So I think what we were trying to say is that there is a lot of confusion on what is our work life and what really is our personal life. So I think what's happening is the work-life balance has really gone out of the window. So, and at the same time, what happens is there is too much reliance on technology front. So, every communication, be it a telephonic conversation, be it a WebEx or Zoom or something like similar what we're doing a Facebook Live, everything is dependent on technology. But as human beings, we are more used to face-to-face socialization. So I think the stress level is much more higher than what it used to be before this particular lockdown. So I think this is what is leading to a lot of psychosomatic disorders, decrease in sleep, and so on. But what's happening is that if you kind of look at you go to any doctor or any person who deals with wellness, they will always tell you that okay, you need to have a certain amount of exercise, at least 30 minutes of exercise in a day. And of course the second thing would be to get a healthy diet. Healthy diet, I mean, diet rich in fruits, vegetables with good amount of antioxidants and so on. But very often everyone misses the third triad, which I often try to point out, is that okay, are you getting enough of sleep? And when I talk enough of sleep, I particularly mean, are you getting adequate quantity? And at the same time, are you getting the right quality of sleep? So we'll try to discuss about what is the right quality and the right quantity of sleep. So, like I said, sleep is something which is missed very often, and I personally feel it is missed very often because it is something which happens on a normal manner. We don't have to struggle too hard to get into a sleeping mode, right? And the moment night comes in, at least for most of us, we go into sleep. So it's a periodic phenomena, it's a regular phenomenon, and for that reason I think most of us are not too bothered around that. So there is also one aspect that why we are not so uh, you know serious about sleep. But if I can tell you, sleep as a whole is not something which is a very passive phenomena. In fact, sleep is a very active phenomena. So, for example, if you look at the American Association of Sleep Medicine guidelines, which is one of the key scientific societies, which deals on sleep disorder, they say that for any person who is from 18 to 40 years of age, at least should get around 7 to 9 hours of sleep, and you can extend that 40 years to 50 years also. But as we go beyond the age of 50, our requirement of sleep also goes down. So you might very well notice that your parents, or if you have elderly or senior citizens at your home, they are probably getting a sleep of around 5 to 6 hours. But on the other hand, if you look at very young children, children particularly who are in the first 5 or 6 years of life, they tend to sleep more. And below 3 years, you must have observed that children are sleeping as good as 12 to 14 hours a day, and that's a requirement because while children are sleeping, uh, their brain is basically getting developed. So there's a lot of brain development which is happening. And for teenagers, it is said that at least on an average they should sleep around 8 to 10 hours a day. So, but then all said and done, sleep is again very subjective. You might come across people who are good with just 5 hours of sleep or like 4 hours of sleep. So I think it totally depends on you how good you want to sleep, right, or how much you want to sleep. But if you ask me, for any individual from 18 to 50 years of age should get at least 7 hours of sleep on a daily basis. So that's the quantity of sleep which you can look at. So like I was also saying that sleep is not a passive phenomena. Sleep is a very active phenomena. And while we are sleeping, most of the the systems of our body, like the muscular system or the circulatory system or the the reproductive system, lymphatic system, all this system gets affected. And worth mentioning is, I think, the circulatory system, which constitutes of the heart and the arteries. So I think while we are sleeping, our blood pressure drops down to as good as 10 to 20%. So the blood vessels get some amount of rest, the heart gets some amount of rest. If we look at our brain undergoes something which I call as good as a car servicing. We always send our cars to a servicing center, and when you come out of the servicing center, our car gets a lot of refreshing. The oil gets changed and so on. In a similar manner, what happens with the brain is there is memory consolidation, there is refreshing of the neural networks of the brain. So if you had a good sleep at night, probably you will wake up very fresh in the morning, and you would be in a better footing to do your day-to-day activities, be it work or personal stuff. And at the same time, let's talk about immunity. There's so much of things going on with COVID-19 and coronavirus. So there has been immense amount of studies that if someone sleeps for, or a group of patients, if they sleep for less than 5 hours a day for a longer period of time, in all probability, there has been studies which say that they are more prone to common cold, and which is actually a viral disease. On the other hand, if someone or a group of patients are sleeping for more than 7 hours a day, they would in all probability have less chances of developing cold, as less as somewhere around 17%, just 17%. So I think that way sleep becomes very important, and all I wanted to say that it impacts your immune system also. So I think let's talk about the quality of sleep. We have talked about quantity. Let's talk about quality. So when we talk about quality, it basically means, suppose we have slept for 7 hours, have we got a good depth of sleep? So if we are having a shallow sleep, which means that the quality is not good. We need to have deep sleep, and deep sleep, I mean, we have to go into a certain stage of sleep, which is known as the rapid eye movement stage or the REM stage. And in a typical night, REM stage is around 4 times in a night, which means that we dream 4 times in one night's sleep, which is quite amazing, right? So that's the depth. But in certain you know uh, section of the society, we always see that uh, you know people tend to snore. So, and it's a part of Indianism or Indian culture, is that okay, if someone is snoring, it basically means that the person is sleeping well. That is something which is a part of our belief system. Okay. But then I think what's happening is that in reality, if you look at different literatures, if you speak to any doctor, they would say that, okay, if you're snoring, it basically means that probably you are not sleeping well. So snoring is one of the reasons which leads to disturbed sleep, okay, for that individual. And in fact, there has also been instances where the bed partner gets disturbed. So why does this happen? So, and what is the impact of snoring overall? So suppose a person is snoring, what happens is the upper part of his airway actually collapses, and air doesn't go inside his lungs. So just imagine if the air doesn't go inside that person's lung, the brain gets activated while the person is sleeping, and the brain pushes the person to wake up. So while that person is sleeping, every time the brain is pushing the person to wake up so that the person can take the breath. So and this happened multiple times in a night, up to 70 to 80, 70 to 100 times in a night. So which means that perhaps in every hour, there has been like 10 to 15, at least on an average, micro arousals. So if someone is having micro arousals, it means that the person is not sleeping well. Okay, so and typically what happens, when this person comes to us, they complain of things like, okay, I have some amount of morning headache, very vague symptoms like morning headache. I have daytime sleepiness. I have some amount of fatigue. uh, you know there are aches and pains in my body. I'm not able to concentrate in my work, and so on. And if I can further, tell you what happens is, suppose it's a female patient. The female patient typically, comes with symptoms like, okay, I am tired, I am fatigued, and very very often it's the female who say that, the bed partner of the female says that I'm, I don't snore, or my wife does not snore, but still she has a lot of headache and fatigue. Okay. Whereas for males, it's much more easier to diagnose because the wife would say that, yeah, he snores. At times, he can stop, breathing, and then I have to push him awake, push him, and then he breathes. And when he, even during the daytime, after having, 3 or 4 cups of coffee, he says that, look, I am fatigued, and I want to go to sleep even during daytime. So I think these are the common symptoms which we come across very often. And if I can tell you, how do you basically diagnose this kind of issues? So typically what we say, for everyone, is that, okay, please go through something which, if you have this set of symptoms, please go through something which is known as a sleep screening. Okay. And which is actually a quiz or a test. So what I can do, I can just share that link with you, and you can meanwhile, type onto that link, and uh, go through that quiz, and I would in fact continue my lecture. So if you can see in the chat box, there is a link, and this is a link to the quiz, which you can probably, uh, you can go through and get an initial assessment at how good are you sleeping, and do you have any risk of something called sleep apnea, which is as a result of snoring. So this is one piece. Okay, this is one piece, and of the entire ambit where people are, where the depth of sleep is really, bad. But I would also like to point out, there are several key reasons why people are sleeping less, and why the quantity and the quality is going down. So first of all, I think the most important point is, if we are from a bigger cities like Delhi or Mumbai, or maybe you know so I think, I see one of the chat where someone is saying that, can this quiz be extended to family members as well? Yeah, I think it's a free quiz, so you can extend this quiz to your family members also. Okay, so I think the most common factor is our work routine, right? So uh, typically, it so happens that we go to office at 9 o'clock, and we are coming down home at somewhere around 8 o'clock, and you want to go to sleep somewhere around 11ish. But in bigger cities like Delhi and Mumbai, where at least 3 hours we are in the streets, fighting the traffic jam, so our sleep has gone down drastically. And then at the same time, there has been an invasion of smartphones and big LCD screen TVs, LED and AMOLED and so on. So more the LED part in the screen, more bigger the screen, it would release something which is known as the blue light. Okay, and this blue light component actually decreases the melatonin levels in your brain. So your brain is not in a right mood to go into sleep. So very often you might feel that, okay, I want to go to sleep at around 10:30 or 11ish, but it is very difficult to get into that sleep mode. And why is that happening? Because there has been too much exposure of technology. You perhaps you're looking at your phones so much now, perhaps you are looking into your TV screens too much. So one thing is, what you can do is kind of cut down on electronic gadgets at least 1 hour before you are planning to sleep. And one thing which we always suggest from a sleep perspective is that uh, please do not take your mobile phones to bed. You know, uh, if you want to use an alarm, try an alarm clock rather than a mobile phone. Because that hampers your sleep. At the same time, if you are in your bed looking at a mobile phone, you get more exposure to blue light. What else? Cut down on your caffeine consumption. Typically, post after 7 o'clock in the evening, uh, don't take any caffeine. Any caffeine, I mean tea, coffee. Reduce that amount, or better not take it, because I think coffee stays in your body for close to 6 hours. Okay, so don't go into that. And at the same time, try to make your bedroom quite cozy and comfortable, in the sense that there should be a dim light. The light should be dimmed. The temperature should be around 24 to 25 degrees Celsius. Okay, so that is something. So uh, I think one question which is interesting, which is coming up, is that okay, so for a mobile phone, reading more on phone will help to cut blue light exposure. So the answer to that question is, I think it's not just the blue light exposure. So suppose you are reading something, right? So there are two things happening. So suppose even if you have a blue light filter in your phone, your brain is not getting that blue light. That's good enough. But when you are reading something from your phone, there is light coming onto your eyes. And typically what happens is that we have trained our brain to in a such a way which says that, okay, if there is light, it's not the right time to go into sleep. Okay, and at the same time, if you are reading in your bed with your mobile phone on, your brain's particular system, the frontal lobe, which is the cerebrum, which basically says that, okay, uh, I'm doing something very important, so let me not go into sleep. So your brain would still be in a very active mode. So that's why I say that even if there is a blue light filter, or even if there is not a blue light filter, please don't do any reading, or don't take your mobile phones to your bed. So that is something which I can uh, tell you. So the other thing, again, if I can come down to these factors which actually hamper sleep, the other factor is probably alcohol. And every one of us feel that, okay, if I take alcohol, I can quickly go into sleep. And that is something which we all realize, that, okay, yes, if you take 2 packs of alcohol, you can quickly dip into sleep. But if you see a lot of researches which has been done over the last 50 years, yes, alcohol puts you into sleep, but you never really get that quality or quantity of sleep. So I think everyone must have realized that if you have taken more than 3 or 4 packs of alcohol, you would have to get up early in the morning to take that sip of water, because you are thirsty. You have to go to the loo to empty your bladder, you know. And at the same time, when you wake up in the morning, you would not feel that fresh. There could be a mild hangover. There could be a very heavy hangover. So taking alcohol before bedtime, or anytime during post 6 o'clock is definitely going to hamper your sleep pattern, right? So I think there's someone who is trying to say that, okay, can you explain sleep apnea? So when you talk about sleep apnea, let's break up the word into two pieces. So one is sleep, which basically means that this is something which happens during while you are sleeping, and apnea basically means, which means that you have stopped breathing. So it particularly means that you have stopped breathing while you are sleeping, and it typically happens because the upper part of your you know the respiratory system, which consists of the pharynx and the larynx, as we call in scientific terms, they actually collapses, and air cannot go inside the lungs. Okay, so imagine a situation where air or oxygen cannot enter into the lungs. Your body is not getting enough oxygen. So if your body is not getting enough oxygen, what happens next is the brain actually wakes you up and says that, okay, get some breath, and then there is something which happens. You don't wake up fully. uh, you wake up something which is known as microarousals. You wake up for some time, and then you take a deep breath, and then you again sleep. But then it happens very often at night. This is not a one time phenomenon which would happen in the entire night. And as I have mentioned, it might happen like, many times, 70 to 100 times in a night. And there are long term consequences which has been established. So if someone is a diabetic and his sugar levels or the blood glucose levels are not getting controlled in spite of taking medications, adequate diabetic medications, so probably we also have to assess that whether this person is suffering from some amount of sleep apnea, and we have to take actions or medications according to that. Similarly, for any cardiac patient who had a past event of heart attack or anything of that sort, we have to evaluate that person for sleep apnea, because if someone has sleep apnea and also cardiac disease, then probably we'll have there could be a recurrence of heart attack. So sleep apnea, in a sense, is a very dangerous phenomena, which leads or aggravates other phenomena like diabetes, hypertension, or cardiac diseases in our body. So I hopefully, I think I have tried to explain what sleep apnea is in a very simplistic manner. Okay. I think there are a few pointers which I also want to discuss. That suppose you take one of the easiest way is to assess what symptoms you have, and then, like I said, okay, uh, if you if you have those symptoms, how do you get to know that really you have sleep apnea? So one is, you can take the quiz which is listed out there in the chat option, and you can do it. You can extend it to your family members. And suppose if you come, it has different scales like mild, moderate, and severe. So if you have or you are landing up in the moderate or severe category, then probably you have to undergo something which we call as the sleep test. So typically, for the convenience of patient, we do sleep test in their home. So which is basically known as the home sleep test, and it's a whole night test where you basically get a device which you have to hook up, and then the device automatically gives you a reading the next morning, that, okay, this is how your sleep look like. And it also tells you, do you have any sleep apnea, or sleep apnea related disorder or not. And and that is something which you can do. It is commonly known as HST. Okay. So and of course, the HST will tell you at what category you are. So we measure HST by something which is known as AHI index, apnea hypopnea index. So if your AHI is more than 15, you basically need some amount of therapy for sleep apnea. So if you ask me, the common therapies I would suggest is some amount of lifestyle modification in the first place, like losing your weight, going for some, exercise, and then probably if all this is not working, I would tell you that, okay, go for something which is known as a CPAP device, which actually opens up your airway, which has to be taken while you are sleeping. Okay, so I think those are the device which ResMed has, and ResMed is a pioneer in those devices. In fact, ResMed was the inventor of those devices. So all said and done, I think these are the options which you have. So it's not just the device; you have to do quite a bit of lifestyle modifications to get the therapy effective. Okay. So that is one. There are a few questions which I may take at this point. So there is someone who is saying that what could be a reason of no proper sleep, even if we are not using mobile, and disturbed sleep when you are getting up after some time. So as I pointed out, there are many factors. The factors would include definitely your electronic gadgets, but would also include certain aspects like how much of caffeine are you taking, uh, how much of alcohol are you taking, are you taking good amount of water before your bedtime. So if you're taking a good amount of water before your bedtime, please do not do that. you know uh, so rather do 1 hour before your bedtime, because water you know would would basically uh, lead to a lot of urination at night, so you'll have to get up from the bed. Other than that, I think one of the most important causes which we commonly see is the stress, and this is something which we see people who are suffering from insomnia. Okay, so we often identify what could be the underlying stress, and then we propose uh, you know uh, medications, which I can tell you is an adjunct. It's not the definitive therapy. And you also have to do something which we call as a lot of behavioral therapy. We have to find out why this stress is happening, and what can you do to remove that stress. But right now, and for that, whenever someone comes to us with problems like, okay, I want to sleep, uh, and I gets disturbed, I get sleepy during the daytime, we ask that person to undergo a sleep test. So if the sleep test, everything is negative, then we try to take up the insomnia piece. Okay. So there are other questions like wristwatches, sleep monitoring. Yes, I think what they do is, if you look at devices like Fitbit, the Apple wristwatch, you will have something known as actigraphy, which actually monitors your sleep, and that can actually tell you how good you are sleeping. But then HST is quite different from that. These watches would be indicative of the fact, they would tell you that, okay, are you sleeping well or not? But HST is much more scientific. It tells you how much your oxygen level is dipping down, how many times you have woken up during the night. So yes, watches can be a good screening tool somewhere down the line. But then if the watches tool is, or the app, wristwatch app or the smartwatch app is telling you that there is some amount of sleep disturbance, you can try HST or any sleep test. Hmm. Okay, so great. This is one another question for someone who is saying that our quality of sleep depends on how peacefully our 1-year-old baby is sleeping. I think I can empathize with you. And could you suggest some tips for sound and quality sleep for little babies? So I think babies have an ecosystem and the mind of their own. Okay, and typically what I understand, someone who has written this in the chat box is probably a new parent. So for a 1-year-old, the most important thing for the baby to sleep is the environment and the feeding habit of the baby. So if a baby has a full stomach, the environment is quiet, light is dim, that baby would probably go into sleep much more easier than any other babies. Okay, so that is point number one. But if you are having a baby who is less than 6 months of age, there's every possibility that this baby is going to wake up every 2.5 hours. Why? Uh, because typically in the first 6 months, babies feed on milk and liquid substances, and they don't stay in the stomach for long. So the stomach emptying time for babies is around 2 to 3 hours. So this is something which we see in the first 6 months, that probably the baby is waking up like 3 to 4 times at night, and that's okay. That's quite normal. You basically have to feed the baby and go again to sleep. Now the problem is the parents are not getting enough sleep. So one tip is, okay, someone can feed the baby at night after 3 months. Someone has to take that responsibility. Usually it's some other, because it becomes easier. And someone has to, and the other parent, the father, might sleep during that period of time. So it has to be a teamwork. But if your baby is still not sleeping well after 6 months, then we have to kind of consider other situations. And typically what we see, once the baby is into solid food or semi-solid food, they take a good nap. The nap, or the night sleep, usually extends up to 5 hours, on at a stretch. So one tip is, okay, you can team up with your partner to feed the baby, and take turns, and this usually resolves by 6 to 8 months. Okay. So and I had a hard time around 3 4 years back, and I fully empathize with the situation, what happens, what goes on with the parents in the first 6 to 8 months for a newborn. Okay. So so there are other few questions which I would take up. Let me just see. Yeah, so there is someone who says that I've been sleeping 5 hours a day. The problem is I go off to bed at 11. I don't really get the sleep, and I'm awake till 4 p.m. or 4 a.m., I think, rather 4 a.m. at night, and I try to do everything possible to get some sleep. So uh, this is again a very common problem. We call this a problem of sleep latency or going into sleep. And typically one of the suggestion is, and I'll share that in my sleep tip also, that suppose you have gone to sleep at around 10ish or 11ish, and you are not getting sleep, or you are just tossing and turning in your bed for the next half an hour to 45 minutes, please move out of your bed. Move out of your bed, go into your living room, sit in a sofa or a table, and try reading a book. you know so that is one exercise which we say. And why? uh, Number one, we always say that your body should be in tune to what your bed is. So if you are in your bed, your body should feel that, okay, the bed is only meant for sleeping, not for any other activity. So when in your bed, I would suggest, don't do any chatting, don't eat food, don't read while in your bed. If you want to do any of this activity, please move out of your bed. So go to your bed only if you are kind of wanting to go to sleep. So so the suggestion is, go back. If you're not getting enough sleep, or if you have a problem getting into sleep, move out of your bed, go into your sofa, switch on the lights, and try to read a book. I'm sure that would help you. Okay, from a behavioral perspective, these are all behavioral techniques which we emphasize if someone wants to go into sleep. So I think last few points which I would like to discuss is that, and pose that we can take few more questions, is that what are these sleep hygiene techniques which we should follow to get into good sleep? And I would kind of combine this with both the work from home scenario and what a normal sleep hygiene should look like. So I think we are all working from home. So try to treat work from home as a real work from home. So get up on the right time, uh, like 7 o'clock if you're getting up. If you would like to get up on 7 o'clock, even if you're going to office. Okay. Whenever you are working, uh, try to uh, try to have something like, okay, I would do my work in a desk and a table, not in a couch or any place else. Okay, that is one piece. But the number one piece which should be borne in mind, that, okay, when you go to sleep and when you want to get up from sleep, that should be a fixed time. So suppose I want to get into sleep at around 11 o'clock at night, and I want to wake up at around 7 o'clock or 6 o'clock in the morning. Please try to maintain that schedule, because again, you are basically trying to tell your body that uh, you know what it should look like. Your body biological clock gets accustomed to it. Second piece, which I say at this point in time, try to draw a line between what is a work from home uh, and what is your personal space or personal time. So try to say that, okay, after 6 o'clock, I'm not going to take any calls, or I don't want to be in a Zoom call or something like that. So that would actually help you to reduce the stress, the work from home stress and the technological stress, which we all are right now going into. Uh, I think the other points which I'll always tell is that, and which is like a blanket point, which I say is that if you want to get into a good sleep, try to get some amount of sunlight. Sunlight. Try to do some amount of moderate exercise, and also what helps really I've seen is that, yeah, try to get a warm bath before you sleep if you want to get a very good sleep. Uh, One thing which again is a hygiene measure, try to shut down all electronic devices, or don't look at your mobiles at least 1 hour before you want to go to sleep. So I think these are the key points which has been emphasized by most of the scientific societies, trying to say that, okay, these are the things which you should do to get a good amount of sleep. So maybe what I can do, I can kind of pause here, uh, and I can take a few more questions if you have at this point in time. So I think one question which is coming up, that, okay, if the baby wakes up around 3 to 4 a.m., should we give some solid food before the baby sleeps? I think yes, you can try that. Somewhere around 9 o'clock at night, you can try give some semi-solid food if your baby is able to take it. Uh, and babies usually are more accustomed to semi-solid food after 6 or 7 months of their life. So you can try that, and because the stomach would be more fuller, so probably your baby would wake up later, somewhere around 4 o'clock or 5 o'clock in the night, giving you some more amount of sleep. Yeah, you do that. Um, any questions? You can type down your questions if you have any. So meanwhile, what I can tell you, I'll give you a toll-free number. And this is a toll-free number which is available during the weekdays, 10 a.m. to 6 p.m. And this toll-free number is, something which you can always call at some, kind of advices on sleep. So this number is run by ResMed, and we usually try to answer your sleep queries uh, through this number. So I'm just putting that particular number on the chat. Yeah. So someone is saying that any suggestions for people working at night shift so that they have better sleep. As in my case, my office ends at 2 a.m. So very pertinent question, and I think we see a lot of people from the IT and ITES who are working at night shift because their profession demands that. So what typically happens during night shift is that your body is basically getting acquainted to a different clock. Okay, so few tips which I can tell you what happens is, and how you can manage if you are a night shift worker. One is, try to maintain that routine, even say during the days when you are not in a night shift. So for example, weekends. So in weekends, probably you won't have night shifts, but then you are probably trying to sleep night in weekends. So what you can do, I know this is quite difficult, so is that you can still try to sleep during daytime during weekends to be more in tune. The other thing, that is one piece, but that's a difficult piece which I can tell you, because everyone wants to have some fun during weekends, spend time with their families. So that is one thing which I am not very strict about. Yeah. The one thing which I always tell is try to cut down on your caffeine consumption uh, during shift. So have at the max 1 or 2 cups of caffeine, and I would suggest having tea rather than coffee, because coffee contains a lot of caffeine. Tea has relatively lesser amount of uh, caffeine. So and suppose if someone is going to sleep at you know 4 a.m. or 5 a.m. in the morning, so at least before 2 hours of planning your sleep, even if you are a shift worker, please do not have any coffee or tea. That is one thing. The other thing for night shift workers which I have seen is that since they are sleeping during the daytime, there is a lot of disturbance going in the house, because most other people are probably active and doing their daily chores. So try to make your bedroom calm and quiet, and have have very less light during the daytime, so that you are able to get good amount of uh, good amount of sleep. And don't try to get into any gadgets. So I think the most important piece is, of course, limiting caffeine. And the second thing, when you are working at night, try to work in a space which has bright light. Basically, you are trying to tell your body that, okay, this is daytime. So at nighttime, your body, while you are working in shift, your body gets acquainted that, okay, let me reset my biological clock. And when you are trying to sleep in the early morning, your body becomes more accustomed or more in tune that, okay, I have received enough of bright light which is required for the body. So let me now get into a rest mode. So three things which you might say. One is, try to have bright light at work while you are working. Limit your caffeine intake, and if possible, try to keep the same schedule even during weekends. So these are the three things which I would tell any night shift worker to get a relatively better amount of sleep. Okay, sure. Any further questions on this? I can wait up for 2 minutes, and then probably we'll close this call. And meanwhile, you can also go through the toll-free number which I've shared. And at the same time, you can also try the sleep quiz link which I have sent you. So I hope you have found this interaction very useful, and you can reach out to me directly through Facebook if you feel you want you have further questions, and if you want those queries answered. So I think thank you everyone for joining this Facebook live, and we'll see you in future. Thank you so much. Take care and have a good night's sleep. Thank you.